Did you know that 2.8 million deaths are associated with obesity? Obesity is a condition that can cause a large rise in individuals' health risks and be very difficult on their life. Over the past semester, I have researched obesity and interviewed Dr. Amy Phillips, and today I'll be sharing my research with you. Hi, my name is Jocelyn Nader, and today I'll be discussing obesity and its effects on individuals' health and the possible diseases that can go along with obesity. This is the Capstone project. I'm doing it on obesity, and I've been working on this all year. There are many things to look for when being concerned with obesity. A lot of side effects of obesity can be heightened and prolonged hunger, longer time to reach satiety, severe preoccupation with food, excessive food seeking, significant distress, inappropriate response if denied food. When an individual has a high end and prolonged hunger, they are very hungry for a long time, and they may eat many meals throughout the day and still feel the need of wanting food, even if they ate over what they should have been full from. When an individual is seeking food excessively, they can be looking for food at night. They could be stealing food from the kitchen secretly, and in some cases, individuals will forage food from trash cans, and possibly there's been some cases that an individual can break into people's houses because they are so desperate for food. There are many known diseases that can be related to individuals with obesity. These right here in this chart can be some of the effects that can coincide with obesity. One can be heart disease, high blood pressure, diabetes, obstructive sleep apnea, high blood cholesterol, and in some cases there can be certain types of cancer. Polyphagia is one disease that can coincide with obesity. In this disease, this can be described as the feeling of extreme hunger at all times. This is in one of the cases, as I talked about earlier, as an individual will eat and still feel hungry all the time, no matter how much they eat, no matter how much they should stay full. The feeling of hunger will never go away in these types of individuals. Another disease that can be related to polyphagia is hypoglycemia. This is where an individual has low blood sugar, and a lot of the times this can coincide with individuals that have diabetes. Also, hyperthyroidism can also coincide with polyphagia. This is where the thyroid is working way too quick for one's body. And why this is a problem is that thyroid hormones control metabolism, and if the thyroid is working too quickly, that can cause many issues in this. Although hypoglycemia can happen to a lot of people that have diabetes, it can happen to people who also don't have diabetes, and it can happen to anyone. This picture is a picture of polyphagia. It's someone who is overweight and is eating a lot of food in one sitting. And in these cases, it will show that this individual will still be hungry after that. Hyperthyroidism again. Hyperthyroidism can be high blood pressure. Signs can be of nosebleeds, face flushing, headaches, blurred vision, being lightheaded, nausea, anxiety, chest pains, palpitations, seizures. And then this quote is from Drama Delvise. It'll be at the end of the resource slide. This is a chart of high blood pressure. It shows that There are different stages of hypertension that can be in an individual. Chest pain is a huge indicator of hyperthyroidism. There are many times where patients have symptoms of chest pain, cardiac arrest. It's very possible when an individual starts feeling chest pain. A high blood pressure can read. A high blood pressure is considered a systolic pressure of 140 and up, and then a diastolic pressure of 90 and up. This is the resource page. It is all the things I kind of went over, and all the information that I have got from these slides have been through these resources. Obesity can be the genetic or the result of past life decisions. Overall, obesity can be detrimental to one's health. Anybody with a body mass index over 25 is considered to be obese. There are many things to look for, like heightened and prolonged hunger, longer time to reach satiety, shorter duration of satiety, severe preoccupation with food, excessive food seeking, and significant distress. And also it can be inappropriate response if denied food. There are many diseases that can coincide with obesity. 2 examples that I've restated in this PowerPoint is polyphagia and hypertension. These types of diseases can be detrimental to one's health. There are many reasons why it is important to take precautions and to look after one's health to ensure that an individual can be in the best possible condition.